Welcome, Professor Sen and all participants for this workshop organized by Tanzanian Summit. So for those who don't know, Tanzanian Summit is a non-government organization working to improve the better governance in healthcare governance in Tanzania. And we host the largest public-private platform in the country in coordination with other 7 coordinating institutions, including the Ministry of Health, PRH, Ministry of Health Zanzibar, TMHS, Association of Private Health Facility, Christian Social Services Commission, and BAKWATA. So we are delighted to have you this morning with Professor Jeremiah Sen from Bugando, who is a chair of scientific committee for Tanzania Health Summit. So Professor Sen is the director for postgraduate studies and associate professor of microbiology and infectious diseases at Catholic University of Health and Allied Science and Bugando Medical Center. So Professor Sen, we are very honored to have you this morning, and I hope the participants of this workshop will benefit from your rich experience, knowledge, and expertise, especially in the area of research. So allow me just to hand over to you, and I think this workshop is for you. And I was just giving short introduction. So karibu sana, Professor Sen.
Asante sana, na I'm really honored to be here, and I hope members you can see again my screen, right? Okay, so this morning I'm supposed to give you just like a brief intro on how you can prepare your abstract in context in line with the Tanzania Health Summit this year's theme. And because of this, I thought I'll give just a very brief, like maybe 10 minutes. And then after that, we'll have like a round table discussion on some critical areas which you would need as the prospective attendee for the coming conference. So it will be like a 10 minutes. And then after that, we'll just do like back and forth discussion questions so that we really assist you in the specific key areas. So I think I've been introduced already. So this is what I want to highlight. So one of the main things whenever you want to prepare, be it an abstract or be it a paper which you want to write, as long as it is a scholarly communication, you want to communicate to the scientific community, then you need to be organized. So there's always a way of getting relevant information in line with what you want to present. And this is very critical because at the end of the day, whatever you present should be compared and contrasted from other similar work elsewhere, be it at regional level, country level, or be it in the world level. So I think I'll start by highlighting on how to do the literature search, and then how to do it systematically, very briefly. And then usually, because we are going to present, you're going to submit abstract. So usually abstract have like a number of sessions, but usually it's like 4 sections. So one of the critical things which usually we want to see is to make sure that those subsections are linked to one another. So that's a second area which I'll highlight in the next few minutes. And then the last one, very critical area again, how do you extrapolate your findings? Sometimes you can have very nice findings, but then how do you do your conclusion? So how the conclusion is actually framed will actually dictate whether you will be able to deliver the information that you want to deliver and to the specific target that you want in context. So I think these are the 3 areas that I want to highlight this morning. So there are a lot of information outside there. And I understand even you are also planning to submit information from the research that you have done. So because there are so many literature outside there, the question is usually, so which one would you choose to send to a scientific conference, or which one would you really later prepare so as you can send maybe someone publication. I understand there are many people who have been asking that where our publication in the previous scientific conference. So the question is, which one are you going to pick from tons of information which is outside there, so that you can compare and contrast it with what you have prepared in your respective research. And usually the information can be found in the peer-reviewed journal. So you can have like journals which you have all those information, but also we have something we call it gray literature. So not everything is published. We have also information which are found in, let's say, government reports, policy brief, technical reports, speeches. So you can also include this as in the citation, as long as that information is publicly available, and as long as the other people, if they want to access it, they will access. So those are the two important things. So you can get it from peer-reviewed journal, but you can also get it from what we call gray literature, where information which you're comparing with your research findings can be either assessed in terms of similarities and differences. And these are the two main search engines. For those who are already in research, I think it's something not new. So you can get information from Google Scholar, and you can also get information from other scholarly search engines such as PubMed. And usually the advantage of this, you get everything you want. It's unfiltered, so you get whatever you want to get. Whereas the PubMed, actually, it's a more stringent portal. It's a more stringent portal whereby you get only articles from journals which are accredited by this scholarly hub. So at the end of the day, if you really want to get some information to compare your results, which you're now preparing your abstract, I think these are the two areas where you can always get. This is also freely available. The Google Scholar is freely available, whereas some of the articles in the PubMed, they are subscription. So you can, so those are like advantages and disadvantages that you want to get. So I just want to give you a scenario. So if you want to really search information, you need to use what we call keywords. So if you're working in a certain area, you need to have keywords. And one of the keywords, for example, I've given an example here. For example, if you want to search, let's say, urinary tract infection, let's say in pregnant women. So you can either use a word all or and. So if you want to search using this, that means you'll get all the literatures which are outside there whose title have UTI and pregnant women. So you'll get tons of them. So for example, if you take this and then you punch it in the PubMed here, if you put it, let's say urinary tract infection, all pregnant women, then you'll get, like I've written, it's like 200,000 plus articles. So these are too much. But if you narrow, if you change this word all and put the word end here in between, so then your search engines have two words, urinary tract infection and pregnant women. So you could see the number of articles which can be retrieved have reduced from, let's say, 200,000 to, let's say, only 1,300 and something. But if you want to narrow it more, let's say you want to look it at country level, let's say only Tanzania. So if you add again end Tanzania, so you could see the number of articles are decreasing from 200,000 to only 15. So these are now the articles which you can now download, put them in your folder, and then when you're preparing your abstract, when you want to do is like linkage, be it PowerPoint or be it an abstract, if you really want to do some linkages, similarities, differences, or extrapolation, translation of the findings, so you have very few which you can go in details and then compare what you want to do. So I think this is the first thing that I wanted everyone to be in the same boat. Remember, again, you can go through Google Scholar, you can go through PubMed. But also remember, number two, you need to use the keywords depending on the subject. And usually we use those keywords linked with the word end so that you can filter and get only information that you want to get. So that's part one. Then part two now, because the format that we announced before, it has like 5 areas, yeah? So like introduction or background, so you have methods, you have results, then you have conclusions. And we have, of course, word limit. So one of the most important things that we really want, and which we'll use as a critical area, apart from many other. The main one, we really want to see these subsections are actually linked to one another when it comes to, positioning your abstract in the context of the world. Hello, member. Sorry for interruption. I think there was a challenge here, but I think you can get me back. So
Yes.
this is where we were. What I was saying like it's very critical to make sure that your subsections in your abstract are linking to one another. So for example, you have your title, which is capturing all the main theme that you want to convey. So you start with an introduction. So this is where now you need to situation your abstract in the bigger picture. So for example, you may start with a sentence which shows maybe the burden of a problem that you want to assess. And then maybe the next two sentences can be the critical gaps or the objectives, depending on how you want to introduce it. But all in all, the opening sentence should probably highlight the burden of a problem of interest that you want to introduce. For instance, you may start in maybe tuberculosis is a disease of public health importance, maybe which is claiming so and so million lives in Tanzania. Let's say you're working on uncommunicable disease, and let's say cancer. So you could start by saying maybe that type of cancer that you want to address is something of public health importance, which is, so you show, the morbidity, the mortality, show the burden of that problem in context. And that one we expect it to be right from the beginning. And then the next sentence there, it depends on how you want to frame it. So you can narrow down either to go straight to your objectives that you want, the broader objective that you want to introduce, or other people prefer you show like a critical gap that you want to address. So, all these things, all these two areas, they complement one another. You want to write therefore this study will be addressing these specific objectives. Or maybe previous studies in Tanzania or in East Africa or in Uganda have been showing this, so you show like a critical gaps, and then you show how your study wants to fill that critical gaps. So that's how you introduce your subject matter. And that's why I started by showing you the literature search, because you really need to know what is known in that area that you want to prepare your abstract. So that at the end of the day, when you're introducing, you say the problem, but also you say the critical gaps. Or you say the problem, and then you say the objectives that your abstract wants to address. And then the methods now, this will now stipulate it at a glance. In this case, you can easily highlight and the study duration in just one sentence. So you can say this is a cross-sectional analytical study which was conducted in Morogoro involving people with maybe people living with HIV. Or maybe this is a cross-sectional study, maybe this is a case control study which was conducted in Manyara, which involved the adolescent in secondary school. Let's say you're working on the reproductive and the adolescent health. So you want like the first sentence to capture both three areas. So you want the first sentence in the method to capture the population, the design, and the duration. And of course, the area where you want to. So just in one sentence. And then from there now, you can add maybe a second sentence, which go into details, maybe the type of variables that you had and how you collected those variables. But at the end of the day, we don't expect it to have like maybe 5 sentences. And the maximum you can do, it's actually 3 sentences only. So the first one can show the population, that is basically the study design, the population, the duration, and the geographical area in just combined in one sentence. And then the second or third sentence can now go down into what are the variables, what are the information that you collected. What are the information that you collected from your data collection tools? The issue of whether you include also the analytical part or not, that's something else. So you can also add a side sentence that the data we analyzed using at high level, maybe logistic regression analysis, maybe Pearson chi-square, maybe simple descriptive analysis. So you can add that. But then at the end of the day, someone should get those big things like, what is your population? Where did you conducted this study? When did you conducted it? What was your study design? And what exactly did you collected in your data collection tool in a very summarized way? Plus or minus the analytic details on the. Sometimes if you have done a complex work, you cannot write a detailed in terms of analysis, but you can just say data were analyzed using maybe SPSS or data software according to the objectives of the study. But if your, let's say, analytical test is straightforward, maybe use the regression analysis, you can say, so maybe the independent variable were compared using logistic regression analysis. But if you really don't want to confuse yourself, you can just say the data were analyzed using this software according to the objectives of the study. So that's the second thing. And those are the few things which you can introduce. Now on the results. So here is where now you want to present what you have collected, what you have. So we expect to bring like a very high level summary. And what I usually advise people when you're preparing your abstract, so make sure that when you're presenting your result, you present your result chronologically based on the specific objective. So for example, you can start with an opening sentence in the result, which again reiterates the population, very brief description of your population. Maybe this study involved 500 people, of which maybe 42% were males. Like, what is this population that you want to describe in the subsequent sentences is actually telling you. So the opening there in results can be a very brief to show just a snapshot of characteristics of your study population before you start going to your specific objective. So you can describe a first sentence using maybe the sex ratio, the male-female ratio, and then the age distribution. That's all. And then now you go now specific to your specific objectives. So you look on the study that you have been doing, and then you say maybe you had 3 objectives. So you make sure that even in your results, the sentences are sequentially arranged according to the specific objective. Let me give an example. For example, you had a first specific objective on looking on maybe the prevalence of, let's say, tuberculosis among maybe people working in mining sites. And then the second one, maybe it was risk factors. So I'm expecting when you're presenting the results, you'll start with a very brief description on the characteristics of that population. So the female male ratio, and then the age distribution. And then the second one, now you will start, the first objective we have said is the prevalence. So you could say, so in this study, the prevalence of tuberculosis among maybe people working in mining was this. So you put a percentage. One important thing that we usually emphasize, don't just put percentage. You need to show the frequent percentage. So these two things should actually be reflected in context. Because if you just say the prevalence was 10%, it may be 10% of 200. It may also be 10% of 200,000 or 10% of 2 million. So that's why we really emphasize that you present a percentage or a proportion with the respective frequencies, the numerator and denominator. So that at the end of the day, if somebody extrapolates, oh, this is 15% of newly diagnosed maybe women with cervical cancer. So someone wants to say, okay, so it's actually 15%. The big picture, the denominator, the numerator and denominator should be there. So make sure that when you're presenting, it's like that. And then I said, so the second objective, the specific objective is maybe risk factors. So I'm expecting after presenting the prevalence, so the next sentence there would be now the highlight on the findings on the risk factors. So you could say maybe the risk factors, which were maybe what maybe so you mentioned the risk factors which you want, maybe existence with HIV AIDS, and then maybe I've already said like the occupation which you have talked about. And when you're presenting this, also make sure that you also include some figures and like values there. So if you have done just a simple analysis, maybe it can be just a simple p-value in each of the variable, those risk factors. So you can put like a p-value in brackets, so you can see maybe the tuberculosis among those people in the mining were associated with the HIV positive serostatus. So in brackets, you say p-value. And then it was also associated with maybe low level of education. In the brackets, you put a p-value. So you put maybe 3 or 4 factors, and each of them you put the p-value in brackets. But if you've done like a comprehensive analysis, so instead of just putting a p-value, you can put a little bit more complex, 95% confidence interval, and then the p-value. So all of those can be in the same. So if you mention HIV, so you can see the odds ratio, 95% confidence interval, and then the p-value. And then you go to the second risk factor, third risk factor, you put them down. So it depends on at what level you have analyzed your data. So if you have done just a simple analysis, I think just a percentage and then the p-value are enough. But if you've done a little bit complex, so you show, if you really want to show like a risk factor, but also you put your odds ratio, 95% confidence interval, and the p-value. So you finish. If you have a third specific objective, that should also be a third description in your result. So if I would summarize again in results, so you open up by giving few like summarize the description of the demographics of your participants in terms of male sex, like female male ratio or sex ratio, and then the age distribution. And then the next one, you sequentially present your results based on your specific objective in your study. And you go like, if it's prevalence, then risk factors, then whatever. So you go like that. And then after that, now you go down to the conclusion. So in conclusion, what the main problem that people do, or the main mistake that some of the authors do, some of them, they bring again the results. So usually in the conclusion, you don't bring again the results. So just pick like the high level summary on what you have analyzed in terms of the results, and then you conclude it down here. So for example, if you're talking of, maybe you say the 10% of people had maybe TB, or maybe 15% of pregnant women were new, or maybe 15% of pregnant women were newly diagnosed with the UTI. So you don't again say the 15% here. So just extrapolate that 15 in the big picture. So for example, if the percentage is 8, so you may say 8 out of 100 people have this. Or maybe you can use the way this prevalence is, let's say, high, low, or moderate, depending on the literature that you have done in the background. So you could say maybe the prevalence of UTI among pregnant women in this setting was relatively higher compared to the general population of this. So you see, you conclude it, but you conclude it in context. And you make sure that usually in conclusion, we also complement it with what then do you want to suggest. So you could say that you highlight on the prevalence and then the risk. So if you're working on the risk, then you say maybe when you want to recommend now, that means those risks would be like priority targets for screening of that target population of patients. So it's like you conclude, but then at the same time you recommend, but your recommendation is again based on the risk which you have presented in the results. So that's the interconnection that is usually supposed to be articulated when you're preparing your abstract. In other words, when you finish up writing your abstract, the title, the background, the method, the results, the conclusion, they should be like complementing one another. So one of the main mistakes that sometimes we get is, abstract is a summary. So you find a person concluding here in the conclusion things which are not in the results. But it's true, those conclusions actually in his they are part of his research findings. Not conclude things which you have not presented in the result. Remember, this is an abstract. So you make sure that first you present all the findings here before you conclude. So basically the conclusion will be like a subset of what you have presented in the results. So I think that's something very, very important. Very, very important. Another linkage is which also sometimes is a problem to some. You have stated your introduction, maybe your gap, and then you don't see the gap in the result, though you don't see the gap in the conclusion. How now your result how that gap has been addressed. Similarly, maybe you have decided to the introduction is, you have decided maybe your introduction to capture your objectives. So we expected again, the results down here should also be addressing that. In other words, linkage of this subsection is very, very critical. And make sure that you don't conclude on things which you have not presented. Don't conclude on things which are not articulated. Don't conclude on things which are not reflected in your introduction and in your research gate. At the end of the day, each of these areas should be articulated. So let me finish by showing you now how, for example, how do you articulate your result? I've given you this example. This is found in our National Action Plan. If you go to the National Action Plan on AMR, the document which the Ministry of Health is using, if you look on the situation analysis in chapter 2, this is part of it. So when you are presenting your result, first presenting the result, this result should be presented in context. And I've just given an example here. You can have like 3 levels of healthcare facilities. You have like district hospital, regional hospital, and zonal or tertiary hospitals. So if your result is including participants from different levels, make sure that it is analyzed according to that level. And when you're concluding, you're also concluding according to that level. Don't conclude, for example, information from tertiary, don't conclude it to be generalized to the district hospital. This is a good example. For example, here, this is the resistance to ceftriaxone for bloodstream infection in the black, then wound infection in the red, call it like brown, I don't know, the red or whatever. And then this dark green, this is a urinary tract infection. So you could see, for example, the resistance to this of bacteria to these 3 diseases, you could clearly see like they're very low in the district hospital. But when you go to regional hospital, the 3 bar in the middle, you could see the resistance is increasing. And if you go to tertiary hospitals, it is also increasing. So this is very critical, so that at the end of the day, when you're presenting your data, you should present this data in context, looking into maybe the level of healthcare facility, looking into the type of patients population you have, looking into geographical distribution that you have. If I could have, for example, pulled all this into one, maybe the resistance would be like 30 to 50%. And if I concluded that 50% to all levels, then because you could see the district level here, the resistance is low. So the message is, whatever you get, you make sure that when you're presenting the result and when you're presenting your conclusion, you make sure that you conclude in context, addressing the subgroups that you have, addressing the geographical area, addressing the level of healthcare facility that you're working, so that at the end of the day, you don't make a conclusion for a tertiary hospital into a district hospital. Or the other way around, you don't make a conclusion for the community-based study, and then you make a conclusion to reflect as if it is a hospital-based study. So I think that's something which is that's very. So in a nutshell, that's. So I should give now the floor back to the audience so that I can take some questions. I understand some of you have already prepared the abstract, some of you have already submitted. So you could always ask a question. In context, concluding your result is specific population, to the geographical area, to the level of the hospital, to the settings, according to what you have prepared. So thank you. So I now welcome you for questions. Let me just stop sharing here so that we can continue.
So for questions, we have Marco Hingi. Marco Hingi, karibu.
Asante. Thank you, Professor. Actually, I'm interested to understand if we can use the same format of the abstract when you want to present a case report. Thank you.
Yeah, thank you very much, Hingi. And that's a very good question. So a case report is, I'll give a cause, I'll highlight on what you have asked, but I'll also add, if someone wants to prepare an abstract where a person does not have the results yet, okay? Because sometimes, let me again share this, and then we discuss from here. Okay, so can you see it, members?
Yes, we can see.
Okay, good. So you can see again the labels, right? Okay, fine. So for example, Michael, if you have prepared a case report, okay, so that means that you will not have the introduction and methods. So if you're preparing, let's say, clinical case report presentation here, so the introduction here can be like a case presentation. Then you present your patients and the diagnostics that you have done, both the clinical and the let's say laboratory, and then the final diagnosis. So I'm expecting the introduction and the method to be merged together into case presentation. Okay, and then after that, then you won't have the results. So for you, you'll just have like a discussion here. You'll have a discussion because you want to discuss if it's a very rare case. Maybe you want to say this is the third case in the world. So instead of having the results here, you'll have a discussion, and then the conclusion remains as it is. So you have case presentation, then you'll have the discussion here, and then you'll have the conclusion here. That's if you want to prepare a case report. But then we have those who have, for example, you have a project, you are still collecting data, but you just want to highlight to people that this is the project we are doing. So you can present, for example, what we call it a protocol, a study protocol. For those who are doing like a control trial, you can prepare like a study protocol. So in that case, you can present the introduction as usual, because you know the introduction. You can present the methods as usual, but then in the results here, in the results and conclusion, you can just put, usually we write the same thing, or study implications. So you don't have results and conclusion, but then you can have just two words, maybe implications or significance of the study. So you just, that's in case when you have like a proposal or protocol, but then you don't have yet the results, but you still want to present it to the audience. So I think those two scenarios could suffice to respond to what Michael Hingi, if you have any other question, maybe.
Thank you. I've got you. Probably, maybe, I don't know. That is, if Tanzania Summit can provide such kind of support. Maybe, of course, you will review it, but probably we don't want to be rejected because of the mistakes of presenting the abstract. Give a room for some of your experts to review our draft before we submit, so that we can have a good chance for acceptance.
Yeah. So in case you have already submitted in the portal, then we'll provide that instruction to our internal reviewers, so that they don't actually reject it straightforward. There is a room, of course, of rearranging the sections, and especially when you're not presenting a classical research findings. If you're presenting a protocol, you're presenting a case report, I think we will be very flexible on that, so that at least we take it back to you so that you adjust it, and then it conforms to what we want it to go. We'll not reject for sure. We'll just make sure that we discuss and put it in context.
Okay.
As long as it has aligned with those sub-themes which we have announced outside there.
Yeah, actually, of course, for issues like traditional medicine, actually, there is a number of things that probably at some point it need a lot of effort, especially for the expert to support, because we have limited expert on the area as well. So that's the thing. But thank you very much for clarification, Professor.
That's good. That's well noted.
Professor, I have a question. Professor, I have a question from Eustachius Kamugisha. Is asking,
Yes,
most of conference committees require the abstract word not exceed 300 words, and you find that you have a lot of data to present, especially the results sections. Should I only report few of them? Please help.
Yeah, thank you, Eustachius. I think that's a very good question. So I think that's where I started by saying, what exactly do you want to present to the audience? Because this is the target audience. This is the audience. These are scientists, policymakers, researchers, practitioners, etc., etc. And you know, the Tanzania Health Summit is it even goes outside those scholars. In the conference, you'll also have the community members who are not scientists at all, and sometimes just maybe standard 7 or 4 leavers. So we want also to make sure that we capture those. So, Eustachius, I think to answer your question, I think what you're supposed to do, go back again to your specific objectives. And then when you go back to, and then see how your specific objectives were addressed in the results. And then just pick those pertinent things that you want to present. High-level summary, and you don't miss anything, but you make sure that what you want to communicate is communicated. I said it again, the best way to do it, go back to your specific objectives. And make sure that you make 1 or 2 sentences in each of those specific objectives. And then you summarize them and present them in the results. So of course, you will know for sure which specific objective is so important. And I think it will benefit much of this audience. Let's say you are working on, what should we say? Let's say sepsis, example of sepsis. So maybe you want to say, what is the burden? So maybe the proportion of people, proportion of the target population who have that problem, but also you want maybe to tell people the risks. But then maybe you want to tell them the treatment options. So maybe the most common organisms and the treatment options which are available there in a summarized way. Okay? But if I want to report it from public health perspectives, maybe you don't have laboratory results. So you could just say clinical sepsis, so the burden, maybe the proportion or the prevalence, and then you just talk of the risk factors. That's all. So it will depend on what you want to communicate. But then at the end of the day, make sure that you reflect it back to your specific objectives. And then when you reflect back to your specific objective, pick out the results which are critical, summarize them into, I said, a maximum of 1 sentence or 2 sentences only per. Maybe if you have 2 objectives, you won't have more than 2 sentences per objective. So the maximum you can have is maybe 2 sentences per specific objectives, because you know the area is limited. And remember again, you have that 1 sentence or like an introduction, which you have it there. So specific objective will be the cornerstone to guide you on what to pick and what to drop. You don't have to present everything. If you're given an opportunity to present it orally, then you'll have an opportunity now to come and give out all what you have. But at this time, only high-level technical summary. Thank you.
Okay, thank you so much.
Any other question? There's a question here that one person say you break up when explaining. Can you repeat just in a summary? So in conclusion, what we said. So in conclusion, don't repeat the results. So what you want to say, you want now to say it at high level. For example, you have, let's say, a burden of a certain, let's talk of non-communicable diseases. For example, you have maybe hypertension in maybe, isn't it? So maybe your title is maybe prevalence and risk factor. Of hypertension in university. So when you remember now, in your result, you'll have the first objective, the sentence reflecting the first objective, that is the prevalence, and then maybe the risk factors. So when you're coming now down there to conclude, So let's say the prevalence was maybe 15% of hypertension based on your methodology based on how you define the hypertension. So if it is 15%, so we don't expect again in the conclusion to say 15. So you need to go back to your literature and see how are these 15% defined. Is it low? Is it moderate? Is it high? So we're expecting not again to bring the numbers down there, but rather you extrapolate that number in the result. In the word like low, maybe the prevalence of hypertension in this population is low, or it's medium, or it's high compared to something like that. So that's number one. But then number two, in conclusion, we also sort of add a recommendation. If you look on the concluding remarks, we also add like, what then do you want to translate? For example, I said, if you have identified the risk factors, so your concluding sentence would be, now those identified risks should be like priority for screening, or maybe the education packages, awareness, advocacy should be actually targeting those risk factors which are identified. Remember, you don't mention the risk factor, but you are extrapolating them. So your conclusion would be, the identified risk factor should be priority for advocacy campaigns in universities, or should be priorities for advocacy campaign in the community. So it's like you're bringing those risky, but then you're like, putting them in context. So you add like that. So don't just copy the result and put them down there. That's why at the end of the day, again, I say extrapolate, translate in context, so that at least people get what you want as a take-home message, but also what you're recommending for future. So back to you, Kaihura. If there's anyone, I don't see anyone in the chat box. If anyone, you can raise your hand. Raise your hand if you have a question, then we'll be happy to support.
So thank you so much, Professor Sen. I think this was very informative and insightful workshop, and I hope the participants have benefited a lot from your expertise. So I don't see any more questions, and this session was recorded, so we'll be sharing the recorded session. So as even for those who are not able to join the session can access this kind of information. So I have shared with you the link for more detail of how you should package your abstract in addition to this workshop. Then you can visit our website on abstract session. Then you will find more information and the link to submit your abstract. So
maybe one more thing, Arnold, just one more thing. The members should also be very carefully in the themes, because we have so many themes. So we have track A up to track N. So because like the competitiveness will be within the theme, within the track, not across. So you make sure that even if your abstract is covering maybe 3 themes, so you make sure that you go for the one which you really think most of the results are covering that track. You may have something to do with basic research and infectious and maybe non-communicable. For example, if you say COVID in people with diabetes, so it's already infectious, and then there's non-communicable like diabetes. So you need now to look at your result critically and see which message do I want to present. Do I want to present message on infectious disease, or do I want to present the message on non-communicable disease? So that when you're selecting, you make sure that you select it in context. I just wanted to highlight that. Back to you, Arnold.
So thank you so much, Professor Sen. And on behalf of Tanzania Summit, we express our gratitude and for setting your time and share with our participants this rich knowledge. And we hope everyone has benefited from this workshop. And I think this will be the end of our session. Maybe Professor Sen, if you have any last word that you want to share with the participants.
No, I'm really grateful. The number is really good. We are 32, so that's really good. We started with 19, now we are 30. That's a very good number. And we'll also discuss if we feel like we need to have another one, we should actually adjust.
Sure.
Hingi has said, maybe we'll prepare like a sort of a brochure which highlight on those other scenarios of case report and protocols, so that we also put them there, so that when someone wants to apply, he knows exactly how to structure the abstract if it is not a classical research article. So I think we have taken that from Hingi. We'll adjust and put it in the website as well. Otherwise, I look forward to receiving the abstract from you. And you can even submit a multiple abstract. That's we're very much welcome. And then at the end of the day, we're looking forward to see you in the conference. Asante sana.
Okay, asante sana. Everyone can put on the camera then for just a very short picture. Please put on your camera. Put on your camera. Okay, thank you so much. Thank you so much. And have a nice day.
Thank you. Bye.
Bye.